Because the idea that blood pressure should be 120 over 80 is a big lie. It's a huge myth for elderly people. Especially if you're over 60, this could be a major mistake. Let me explain it to you. You need to understand this so you don't fall for these misconceptions, especially the ones you see online. But this whole 120 over 80 thing, it started because of a generalization. Wait, what's that? A lot of times we look at the guidelines and generalize, forgetting the individual, that each person is unique. I'll explain why there's this particularity after age 60. This could change everything. Let's start talking about this, and I'll show you two charts. Actually, it's one chart here with two references. And you'll start to understand this myth right here. The first is the chart, the row in this case, from the United States. And next to it, we have the row from Europe. You can see that these two well-respected guidelines that were created based on several scientific studies, actually have some disagreements in what they consider the normal range. You've probably heard about this already, that some studies even consider 120 over 80 to be high blood pressure. But I want you to focus here on these numbers that are being shown. If you look at it overall, what are you going to find? That 120 over 80 is a very good blood pressure. But why am I making this video then, to talk about this? Because these numbers classify the disease and its severity. For example, a blood pressure of 160 over 80 is already higher, and it carries a greater risk than 140 over 80, or even 120 over 80 itself. And what is that risk? What can high blood pressure cause? If you have grade 2 hypertension, for example, what can that lead to? When the body starts working with elevated blood pressure levels, the heart has to pump blood to overcome this resistance. Why is that? If blood pressure is elevated, higher than it should be, the heart has to work harder. It has to operate under higher pressure levels. And what can happen because of that? It can become muscular, which we call a hypertrophied heart. A muscular heart, the heart can also grow. It can lose function. It might not be able to perform its job of oxygenating our whole body. And we also see consequences in the kidneys. We call this hypertensive nephropathy. In fact, this can happen quite quickly. There's even an acute phase of it. In our brain, the risk of having a stroke, also known as a cerebrovascular accident, CVA, increases. High blood pressure is one of the major risk factors. So high blood pressure needs to be watched very carefully. Another thing, it can also harm your eyes. In fact, it can even lead to blindness. Hypertensive retinopathy can damage several organs in your body. So it's very important to pay attention to your blood pressure. But when we individualize, when we do this, I want you to understand that it becomes something very personal, especially after the age of 60. I was in the office. I was seeing a 78-year-old woman who had very unstable blood pressure with several spikes. Today was her first appointment, so I was reviewing the data she already had, and she had a lot of spikes. Sometimes her blood pressure would go up to 160, sometimes even 170, the systolic pressure, that first number, which is really dangerous. Sometimes she had the second number, which is the diastolic, from 90 to 95, is also very dangerous. And sometimes a blood pressure of 90, the first number being 90. 90 over 50, 90 over 40, sometimes 100 over 50, which in this case can be very dangerous. Why? Because when blood pressure drops, there's an immediate risk to life. Why? The person might faint, might lose consciousness. They could be in a dangerous situation, maybe on a staircase or in an environment where there's a risk involved. Or they could be in a safe environment, but with that kind of blood pressure, they could still fall. And what can happen when an elderly person falls? They can break a bone. It could be a femur fracture, a hip fracture, or even fractures in the vertebrae or ribs. Low blood pressure here is also very dangerous. In some cases, this is one example actually. I saw a patient like this today. I didn't want to set her target at 120 over 80. What? The other doctor was setting her target at 120/80, but she was falling a lot. She was having a lot of side effects, and sometimes her blood pressure would go up, sometimes it would go down. This was very dangerous for her. So, during this period, for elderly people who are at high risk of falling or can't control their environment well, which is very common, sometimes you're out on the street, for example, and you can't control what might happen out there, and you can't just stay locked up at home all the time, right? So, when someone has blood pressure spikes and their pressure gets too low, it's a warning sign. There's something wrong with the treatment, and that needs to be reviewed, okay? And if your blood pressure of 120/80 drops too low, that can also be very dangerous. If you just look at that chart up front with the general values, you might think, oh, if the average is 120/80, then everything's fine. It's perfect. But in reality, the average might reflect times when it's way too high and other times when it's way too low. So you can't just go by that. You really have to look at each individual blood pressure reading. That's the first point. The second point I want to highlight here is that many elderly people have very aggressive treatment goals. And besides the risk of falling, there are also side effects, secondary effects from the medications. Some have issues with potassium, others have problems with blood sugar levels. And all these medications, often in excess, to lower blood pressure and reach that target of 120/80, also end up increasing other side effects, okay? So there are two crucial points here: evaluating overall health, other problems, assessing the risk of falling, and also evaluating the risk of complications in the medium and long term, along with the complications in the short term. Because if you set a target of 110/70 or 120/80, often the patient will have to change their diet. It's very important to take care of your diet. If you're taking medication for blood pressure, or if you're managing your blood pressure, you need to be disciplined with your diet. It's not enough to just measure your blood pressure, but there's something that will directly impact your blood pressure, and that's sodium. The amount of salt and sodium you're consuming. Studies show that in the United States, Germany, Spain, and even in Latin America, people are consuming double or even more than double the recommended amount. That is 10 grams of salt, 11 grams of salt, 12 grams of salt. And the recommended amount would be 5 grams of salt or 2 grams of sodium. And why does this happen? Excessive consumption of ultra-processed foods, adding too much salt to your food, cold cuts, processed meats, packaged foods. All these foods will have an excessive amount of salt and sodium, and sometimes you're consuming them. There's a day when you end up being more careful, you don't eat them, and on that day you end up feeling unwell because your blood pressure gets too low, because your body is used to higher levels of sodium. So ideally, you should always stick to that limit of 5 grams of salt or 2 grams of sodium. Sodium is also listed on the labels there. That's going to be essential. There's no point in varying too much, because sometimes you end up with blood pressure that gets too high or too low, which is extremely dangerous because of your diet. The message I want to get across in this video is that it always has to be individualized. I agree with that protocol. I think it's correct. That's what I always aim for, okay? I don't want to give the impression here that 120/80 is wrong. Not at all. On the contrary, it can definitely be a target blood pressure, but you have to watch out for the exceptions, especially with the side effects and the risk of falling. Many times I tolerate a blood pressure, 130/80. In some cases, even higher than that, 135 or even 140, in people who really can't afford a sudden drop in blood pressure, because that could directly put their life at risk. And I'm not exaggerating here. For example, a 90-year-old person falling down the stairs can be extremely dangerous, more dangerous than keeping their blood pressure at 140/90, for instance. So it's not an absolute truth, and an experienced doctor should assess these nuances, these details, before telling everyone that everyone should have this kind of blood pressure, because that could come at a very high cost. And I'm not talking about money. Another point I want to talk to you about here is blood pressure measurements. You've probably noticed that many times when you go to the doctor's office, your blood pressure is high. Or sometimes you have high blood pressure, but when you go to the doctor's office, it's low. That's why monitoring your blood pressure at home is so important. If you take medication, I always suggest to my patients that they monitor it once a day. For those who don't take medication, it can be a bit more relaxed. You can monitor it about once a week. For those who are in the pre-hypertension stage, right on the edge. You saw the values earlier. For these people, twice a week is good. And it's always important to check at different times and also write down the readings because that way the doctor can see and really know how your blood pressure is doing. There are many people who go to the doctor's office, have high blood pressure there, and then when they get home, their blood pressure is normal. This is real. It's high blood pressure, but only at the doctor's office. If that's your case, write it here and also mention the city you're from. And let me know if you like this video or not. Did you have this question? Have you ever experienced something like this? Did they end up giving you a lot of medications? Did you have a fall? Or have you ever broken a bone because of this? Or did you have the opposite side effect? The effects of high blood pressure. Write your experience here, because I always enjoy reading and also learn a lot from you all. And another very important thing, did you know there's a sign on your neck that could indicate you have an increased risk of having a stroke, also known as a cerebrovascular accident? Would you know how to recognize this sign? I've already made a video about this, where I talked about it. Signs and symptoms of a stroke. You need to have this knowledge so you don't make the mistakes I mentioned in the video as well, and have a much better chance of being okay. If you click here, you'll be directed to that video, and you'll learn more about these signs and symptoms of a stroke. Take care. See you next time.